I don't know if you've seen the letter that was addressed to the legislature and to me in particular that talks about this grant, and there's been things reported in the news, which has, I think, been the provocation of some of the questions that you're getting, and maybe Commissioner Ehlinger. But if I read from the governor's letter, he says, and he directs this at me personally, not the legislature, not the Senate, not the committee, but me. And I want to ask Commissioner if this is accurate. He says that my imposition of my personal ideology is unwarranted, and I assume he means because I followed the process in law. And he said that I'm imposing this and preventing people with urgent needs from having their needs met, and that that's unconscionable. And then he said that he, meaning me, that I will severely harm 5,000 Minnesota children with cancer and their families. That I will harm severely 5,000 children with cancer because I followed the law and asked for a review of this grant. Now, I want to ask you, Commissioner, is that description in the governor's letter of what we've done and the description of what your grant will do, is that accurate?
Senator Hann, members of the committee, the activities that we provide through the State Health Department really work at a population level. They really try to do the surveillance, the monitoring, and improving all of the care that goes on. If we do not improve the care for children with pediatric cancer, if we do not improve the immunization rates, if we do not improve the various health promotion and protection activities that affect all children, and raise it to the highest level possible, yes, children will be hurt by our lack of attention to those kinds of issues. So
let me ask you directly. Am I personally severely harming 5,000 children because I said we should have a review of this grant? Am I doing that, Commissioner?
Senator Hann, if this program is not implemented, we will not be doing the best we can for the children of the state of Minnesota.
This doesn't say, and nothing in the things that we've contemplated in law would say that this grant would not be accepted. It's a question of when it would be accepted. And we're talking right now about what it does, and as I'm hearing this discussion, my sense is that this is not about making sure people get screened, because they are going to be screened regardless of whether this grant is. It's about improving an existing system of data gathering for assessment, which is maybe perfectly fine and legitimate. I'm asking you about the characterization of my actions and the description of them by the governor, whether they are accurate. And I'm assuming that you had discussions with the governor about this before he wrote the letter. And the reason I'm asking that is because when you and I talked about this, this didn't come up in our conversation. You never told me that if I did not let that grant go through, that 5,000 children would be severely harmed by following this process. And I just want to make sure that I understand whether I was being told accurately by you at that time that these grants and the questioning of them would not cause harm, which is what you did tell me, or if the governor's right and they will cause harm. And I'm asking you directly, is this characterization of our action accurate by the governor?
Senator Hann, when we met in your office and we went through these grants, we said that across the board that the lack of funding of these grants, the lack of implementation of these grants would affect individuals in this state.
I'm not asking whether they would affect individuals. We can stipulate that anything we do in state government will affect individuals. Right. The governor is saying that my actions will, not maybe, not possibly, they will severely harm 5,000 children. I'm just asking you to validate that statement, yes or no.
Senator Hann, in our conversation, we did start going through the various grants. And we went through 2 grants, one related to primary care providers and one related to immunizations, where we gave you the details. At that point, you said we would not talk about any more grants, so we were not able to go in your office, go through each of these grants because of a meeting that you had to go to. So we were only able to go through 2 of the grants. Those are the 2 that you agreed that could move forward. We did not discuss any of these other ones in detail in your office.
So when I asked you the question whether anybody would be harmed by the acceptance of these grants and you told me no, is that accurate or not?
Senator Hann, I don't believe that I said that no one would be harmed by the by not having these grants.
In fact, Mr. Chair, I was also in attendance at the meeting. I seem to recall that question by you, and Dr. Ehlinger said that there would be repercussions to that, and we began to talk about the grants in more detail. And as Dr. Ehlinger said, we only got through 2 of them and weren't able to discuss this grant.
Well, Commissioner, with all respect, that is not my recollection of the meeting, because I asked you that as a general question, and you gave me 2 grants that we subsequently agreed to release because you felt they met that criteria, and we didn't debate that with you. We said, fine. But you did not mention this grant at all in the course of that discussion, and I don't believe that I was in a hurry to get out of that meeting. And I have my staff here that we can debate recollections, but I'm asking you today if the characterization of the governor's in the letter, if that is accurate. Because if that is so, the question I would have is, number one, why wouldn't this grant be declared urgent at the beginning of this process in October? Number two, why wasn't anything in our last budget addressing this, since it will severely harm children if we didn't do it? Why wasn't that part of your budget proposal? It's only a few $100,000. I know that's a lot of money, but in the course of our budget, that's not a lot. If we're saying that we're going to harm 5,000 children, why wouldn't we have put the money for this process in our budget that we passed earlier this year? There is something wrong here, Commissioner, and I'm trying to understand whether I'm getting an accurate description from you or whether the governor's description of this is inaccurate. One of them has to be true. And I'm just asking which one is true.
Yeah, well, Senator Hann, there were 3 parts to the question statement. One is, we did try to go through the grants in your office, but we were not allowed to go beyond the 2 that we talked about. And we did, and I did state that these, not funding these grants, would have a negative impact on the health of Minnesotans. And we'll go through what, and we're going through the kind of impact it'll have.
So you're saying that, that this would severely harm children. Is that correct? You agree with that assessment?
Senator Hann, it will have a negative impact on the health of children.
It's not what I'm asking, Commissioner. I'm asking you to validate the language the governor has used in his letter characterizing our action on this grant. He says it will, without question, that it will severely harm. And I'm just saying, is that true?
Senator Hann, just like urgency has some different kinds of definitions, significantly harm, I believe that the lack of funding of this grant will harm Minnesotans. Significantly is a judgment of magnitude.
And if that is the case, then I think that it was, if you believe that why you wouldn't have told me that in my office, I think, since the other grants that we talked about, as I recall the conversation, you said there was a potential that they may result in something not happening that could result in something, but you did not describe any of these grants as causing severe harm to anyone if they weren't adopted immediately. You did not say that.
Senator Hann, I don't believe I had the opportunity to do that in your office.
We met in my office for an hour, Commissioner. You had plenty of opportunity. And I want to continue to allow Ms. Meyer to review the rest of these grants, and if we have further questions on this or others, we'll come back to that. But